Morning, everybody, or afternoon. Thanks for everyone for joining us today. We really appreciate it. Today, our community hub is hosted by the Health Gospel. So I'm going to hand over to Faith to share and update us on what's been happening about the Compassionate Hub that the team are running there. So thank you, Faith. Over to you.
All right, thank you so much, Amy. My name is Faith. I am the Projects Development Officer for the Health Gospel CIC. We support Black migrants living and working within North East Lincolnshire. And we have recently started the Compassionate Hub, which is a mental health support service that we are currently running. Can I have the next slide, please? So this is the flyer. It's a bit compressed because of the format, but this is the main flyer that we give out, which has got everything summarized on what we are doing with the Compassionate Hub, as well as the contact details of who to get in touch with if people need, or if people are in need of our Compassionate Hub services. Next slide. So by definition, the Compassionate Hub is a culturally competent mental health support, and it supports Black and minoritized communities living within North East Lincolnshire. I will explain further thank you. So it is a dedicated mental health support services that is designed for Black and minoritized communities, and it provides culturally sensitive emotional support, advocacy, and crisis signposting. So within the Black community living and working in North East Lincolnshire, there is a bit of a misconception as to what mental health is. With the Compassionate Hub, we are able to provide a space where conversation around mental health can happen in a more open space, and everyone can understand what that is all about, as well as making sure that people feel safe enough to approach us, safe enough to discuss mental health issues without feeling the stigma that is associated with mental health issues. It's also run by professionals or trained practitioners who are able to support and to run the service with the rest of the community and the rest of the affected that will come and try to access the service. Next slide, please. So just a brief about what it's mainly about. So what we mainly aim to do is to bridge barriers to mainstream and mental health services. That is to look at what are some of the reasons that perhaps people from the Black communities are not accessing mental health services. So we try to look at these barriers and we try to address them within the Compassionate Hub setting. We also undo cultural stigma and lack of representation. So we understand that people have a different belief or view of mental health generally. So we try to address some of these things. And like I mentioned before, we aim at making mental health a topic that is actually discussed openly within the Black community without people having to feel any form of stigma that surrounds it. We provide a safe and trusted community-based support. So we have a safe space at our office. We have a place that is really dedicated for mental health support, and we have a trained practitioner who works with the people within the community to address any mental health issues that they may have before they get critical. And we also act as a bridge between the community and statutory services. We do signposting, and we try as much as we can to advocate for people within our community in their various institutions, as well as also just making people aware of the mental health services that are available to them all around in North East Lincolnshire. So I will pass on to my colleague, Emily, to take over.
Hello, can you hear me? Hello.
Yes.
Yeah.
Yes,
Yeah.
we can hear you.
So my name is Emily, and I lead on the Compassionate Hub. I lead on it. I am a qualified counselor by background, and so I'm just going to present what we actually do. So what our core services are. We do offer emotional support and listening. We do actively listen to our individuals. We do express empathy without judgment. And I think that's really important, because if people don't feel heard, it can be a challenge to convince them to say that we are here and we hear you. Because most of them, they feel unheard, they feel misunderstood, but this space allows them to be vulnerable. And then we also have the crisis signposting and early intervention. So we do recognize that we can signpost if people are in crisis. We do signpost. We have signpost actually in the past to agencies. We've used Navigo. So, and we do tell them, we do involve them all the way, the whole process. We do involve the clients themselves as well. We do the advocacy for families and young people. So it is due to the systematic inequalities and cultural misunderstandings in different settings, in schools, in education settings, in workplaces. People are misunderstood. And I can give an example, like there are certain cultures where people speak, and when they speak, they actually speak loud, but that doesn't mean they're being rude. Or sometimes the dialect is a bit complex for people to understand. And this, it gets people in a lot of trouble. But so people always feel like, how can they express themselves? So that's what we are there for. We tend to advocate for people in situations like that. So normally we tend to attend appointments, school meetings, GP appointments, hospital appointments, just to ensure that people have a fair treatment. So we do also support, we do have the guidance navigating NHS and community services. So when people move to this country, they do know about NHS, but they don't know how it works. They don't know how systems work. They don't know about the community services that are available for them. So we do tend to encourage, it's like I'm sorry, have I missed something? I think I missed, support with workplace stress and integration. So with workplace stress and integration, we do encourage people to read workplace policies and procedures. This is like one thing we emphasize, that they have to read the workplace policies. And we do have our own meetings as well. Yeah, we do have like our own 2 weekly meetings, and in these meetings we normally talk about, it's a whole group, so we normally talk about work-related stuff and how people can integrate into the communities, if they don't know how to deal with situations, who to approach. We do just give them the guidance for them to actually understand the system, because if someone's migrated here, they're completely different systems here and different systems from where they come from. So we do offer that support, and also, the guidance navigating NHS and community services. Like I said before, we do encourage them to register with GPs, dentists, opticians, so they can have that care. And like with work, we do encourage them to also register with Unison. Yeah, thank you. Next slide, please. So this is the next slide. It's culturally competent support. So we talk about delivered by BEM lived experience practitioners. We do have shared backgrounds of, trauma tailored assistance. I mean, we do offer the trauma tailored assistance due to the backgrounds we share. We also recognize that trauma can't be separated from the experiences that people have to go through when they actually migrate into a country and try to integrate into the communities. It's not something you can say, oh, I'm over it, or I'll leave it behind. It still impacts on us because there's so many things that can trigger all this trauma. So we do try to deliver that as a lived experience to them as well, to understand that this is how it is, this is life, but we just learn how to live with these experiences. And then there's an understanding of cultural norms and stigma. We do have shared beliefs. Mental health is a taboo. We do not talk about mental health. There's a stigma to it. It's a sign of weakness. It's, people don't even recognize that they're having mental health issues. They just have no idea. They just don't understand the symptoms. So we do try to encourage people to recognize the symptoms and come to us to seek, so they can seek help as soon as possible. It doesn't matter how trivial it is, if it's making somebody feel the way they feel. So we do encourage them to come to talk to us. So we do have a safe space for individuals who feel misunderstood elsewhere. We offer that space for them to express themselves freely. They can speak how they want or how they feel, so that we can understand. So they understand that we do understand. And if they struggle, we do sometimes accompany them, or we do ring. Especially, I think the most problem is with the GPs. They don't tend to understand when we speak, the kind of struggle. So people are not getting the right treatment at the right time. So we tend to represent people. So we offer this safe space for them to come to talk to us, and then we then take it from there with them along the way. And then the next one is builds trust and long-term engagement. So this one here, we do hold, sorry, my phone is just sliding, sorry. Yeah, we do hold space in a way that is not only compassionate, but also informed by individuals' experiences with empathy. So we tend to build trust by following up. Like if they've been to appointments, we tend to follow up, or if they've come to us and we have had those talks, we do tend to follow up, we check in, we do home visits, and we always maintain confidentiality, because that's the only way we can build trust and long-term engagement. And we do always let them know that there is an open space. It's open for them to keep coming back. There is no end to it, to the help we offer. Can you have the next slide, please? Oh, sorry. So immediate support for individuals in distress. We always encourage our members of the community that if they're in any situation, they should always ring 999. Even if we are there 24 hours, we always encourage them to ring 999. If it's an emergency, if it's not, we still do tell them to ring 101 or 111, sorry. But we do always advise, we always post these things, we always have like a compassionate hub contact details on there. We do post this on our group every 3-4 times a week, so it's a reminder, constant reminder that if anybody needs help, it's there. So we do also do referral pathways we've done referral pathways to NHS, we've done them to safeguarding, we've done them to schools, community organizations, and this is also with working with the person themselves. We don't do it without their knowledge, so we have to do it along with them so they know what's going on. We also do try to make sure that individuals access the right help at the right time. So we do normally we do try to talk to people. This is communication is really important, and we listen. We do try to assess situations and make sure we signpost them to go to places as soon as possible. Next slide, please. Right, so the advocacy for children facing bullying, we do encourage parents to work well with schools and to create that relationship with schools. And then we have support for parenting, navigating systems. We do these meetings. I know I keep going on, but these meetings are really helpful. The ones we have every 2 weeks, they do help people to raise their concerns. So if people are struggling in schools, navigating schools, there's that help. Improved confidence, behavior, and well-being. So with that one, we do offer strategies like self-help strategies, lifestyle changes, and professional help. We have health sessions at the Health Gospel where people can come in free of charge, no payments as well. So I think I'll stop there. Thank you. Oh, sorry, no, I've got, yeah, I think that's it.
All right, thank you, Emily. Safiat, our colleague, will talk about community impacts.
Thank you, Faith. My name is Safiat Moshood. Compassionate Hope, how it affects our community. Over 150 individuals has, received support from the Compassionate Hope, which my family is part of it. We've supported families, individuals from the BME community. And also we have a 24 hours helpline where members of this community can reach out in case they have they need to speak to someone 7 days a week, 24 hours a day. There's a helpline which is available for members of the community, which makes it easier and kind of relieving to individuals when whenever I'm overwhelmed, whenever I need something, whenever I feel tired, whenever I feel, oh, I'm losing it, you have someone to speak to, you have someone that is ready to listen to you. So this compassionate or provide this service, which is a very good one, then migrants and the frontline workers really, really trust this community for supporting them. It has helped, the Compassionate Hub has helped, especially with the frontliners, how to balance family life and work life. Migrating to a new environment, stabilizing yourself with work life and family life in the midst of culture shock could be very, very challenging. The Compassionate Hub has helped families to balance this work life. Also, it strengthens the well-being and resilience of community. Knowing that you are not alone in whatever struggles you are facing as a migrant is relieving, and is heartwarming to know, oh, I'm not alone. I have a community who always got my back, who will always support me, who will always hold my hands through any struggles and any challenges I'm facing, settling down in a new environment. Next slide, please. Okay, the Compassionate Hub provides a safe, cultural attuned space, a space that is safe, confidential, 100% in matters that are very, very confidential. We look at each culture and put in place, respect culture, and relate with everyone's situation according to their culture and their cultural background, because it is part of the BME community, which are very culturally inclined, and relating to people in that aspect needs putting into consideration the cultural background, where they are coming from and their belief. So what we do at the Compassionate Hub, we look at individuals' cultural background, where they are coming from, how do they relate. So it's a safe place for everyone in the community where they can get to discuss whatever issue they want, putting in place their culture. Then we build emotional resilience through peer connections, where we have our fortnight meeting. You meet your colleagues in your career field. You meet colleagues of your age group, your peer, where you can all interact, share ideas, share experience, and share feelings about whatever issue it's you have on ground. So it helps open up where people can safely talk and relate about matters that affect them. Yeah. And the well-being and emotional safety is guaranteed. What this compassionate hub do is making sure every member of the BME community has a proper well-being and emotional safety. The community help people to make sure their mental health, their general well-being is prioritized, is not being left out of their daily life. Compassionate Hub takes care, looks after well-being, the general well-being of every member of the community, making sure their mental health is stable at all times, and provide support and help where needed for any member of the community. Looking at where we came from, where it's kind of socially interacted, changing location to where it's less socially interacted, people get depressed and isolated when they change environment to places like here. But what this compassionate hub do, we try to reduce isolation and loneliness by coming together every 2 weeks, every monthly meeting as well, to bond, relate with one another, bringing that social behavior back to life, having parties, dinner, tea, um, you know, early morning coffee and tea, where you can talk to one another, relate with people, instead of being depressed and isolated in at home without talking or interacting to anyone, which we all know such things like isolation leads to depression, and depression leads to mental health challenges. So Compassionate Hub is trying to reduce this issue by bringing people together, um, organizing meetings, coffee, and all that. The Compassionate Hub brings together and identify different cultures and respect everyone's culture. We try to coerce different cultures together, where we organize um, events like the Afro-Caribbean event, like the Africans and the Caribbean event, parties during the summer and all that. The Compassionate Hub tries to cohere different type of cultures, different type of background, different type of religion together, where we can all bond together to get a safe and healthy environment and coexistence. Also, the Compassionate Hub celebrates and identifies cultures, lived experience, where we all celebrate each other's culture and religion and backgrounds, where no one is left out. Everyone from every culture, from every background is welcome and celebrated. No one is left out, irrespective of your culture and the background you're coming from. Also, the Compassionate Hub strengthens community belonging. Every member of the community, whenever they think of, oh, I belong to a community who is always there for me, who is always representing me, who is always giving me support and help I need, it makes them have that, sense of belonging and kind of pleasure to say, oh, yes, I'm happy I have a community that that's got my back, that helps me when I feel down. I have to go to them. I go to them and I always get support. My family needs support. We go to them. We always get that support. It strengthens that sense of belonging, that, okay, yes, I belong to a community and I'm happy. I have someone to represent me. Also, what the Compassionate Hub do, we reduce stigma. We reduce social fragmentation. We do not let people feel down or less about themselves. We make everyone feel you matters. Everybody matters, irrespective of your culture, irrespective of your color, your skin color, irrespective of your career, irrespective of whatever your status in the society, everyone matters. We reduce that stigma. We make everyone in the community feel special and feel like a human being, and which everyone is special. No segmentation, everyone matters. Also, this Compassionate Hub has rebuilt trust with underserved BAME communities. Looking back at some years, people feel, oh, I can't really go out. I can't talk where other people are talking. Or if I even go to maybe my GP or access any service and talk, oh, they're not going to reckon with what I've said. They're not going to, take me serious. They're not going to do anything about it. So what the Compassionate Hub is doing is trying to rebuild that trust, to say everyone in the community, whatever you do, whatever you say matters, taking into consideration. That trust is being rebuilt, that, okay, if you have any issue, is confidential and is going to remain confidential. Building that trust where people can feel safe to say, okay, I want to talk about this. I hope it's confidential. I hope it's safe. I hope my personality is safe. I hope my identity is safe if it is things that relate to confidentiality. And yes, they get that same trust. That's one of the things the Compassionate Hub is doing, is building trust in confidentiality in the BAME community. Trust and access to services. What the Compassionate Hub do, it makes trust for people in this in the BME community to have access to more service. Sometimes some people do not know where to access service whenever they need these services, and they just be on their own. And but what the Compassionate Hub does is try to make them have more access to services they need. It also bridge gap between the NHS and the local authorities, VSAs, partnership where we signpost people to get the proper help they need. The Compassionate Hub also increase uptake of health and well-being services, collaborating with agencies where they need help, like Women Aid and all other stuff like that. Thank you. I think I'll stop there. Thank you.
All right, thank you so much, Safiat. Taiwo will look at systemic and the systemic impact.
Oh, hello,
Taiwo, over to
everyone.
you.
Hello. I'm not going to take much of our time. I'm just going to run us through what the impact of what we do as Compassionate Hub is going to do to the system as a whole. Is we hope, and then this is what we have also been doing in the past years. It's been helping the system level with benefits. This is making impact in the sense of helping the system get better as a whole, not just only individual services, because we're connecting people to access the right health care that they need at the right time. It's really, really very, very important to us, and we'll be providing real-time insight into community needs, because we have professionals that are mental health competent, so they are able to know what people actually need at the right time when it is happening. We don't wait until it's too late before we identify problems among our people in our community. So this helps us to do the proper referral to the right channels. We've been helping to partner. We help partners meet equality and early intervention goals, because we believe that with our services, some people that were not reached on time, the groups that are not actually getting that support that they needed at the right time, through our services, we are helping people we're helping the system to become fairer to them. We're helping the system to act earlier, because we reach out in time, and then people get that big touch that they needed, the connection that they needed in time. This has reduced duplication through collaboration with us. From our assessment, the system don't necessarily need to start all over from what the jobs we have done on our part, because we have professionals that have done the job. So we do collaborate together. We do these collaborative jobs, which help us just to prevent repeating the jobs all over the place. There's no need to start doing all the assessment from what we have done. So we just share information from what we have done, and then the other aspect that we refer people to, they just take off the job and they continue from there. Can I have the next slide, please? Then we have, through our Compassionate Hub assistance, we've been able to help in early identification of crisis, and then preventions of some issues that's supposed to have gotten worse. So we pick up problems on time rather than allowing them to get worse. So this has really, really, really helped us to make people connect people to mental health services in our community. Again, we identify risks before crisis. We already know when people have degeneration in their mental health, and then when there is safeguarding risk or social issues. So this helps us at the identification of this risk, help us to really do what is actually supposed to be in place, do appropriate connections to the right channels before it becomes a real problems, or because before it becomes a worse situation. We also support in navigation of health, legal, and safeguarding system. So in terms of because so many people are among our community really don't know where to go, who to approach. They don't know what it's sometimes what is a legal issue. So we, through our meetings and having to direct people, we let them know this is what has to do with health services, this is legal issues. And then when it comes to safeguarding issues, we also refer them for safeguarding processes. So this helps a whole lot rather than people just suffering in silence. It reduces avoidable A&E and safeguarding escalations. So from our services, we have helped to identify issues earlier, and then this has now brings fewer crisis situation, and it has also brings fewer emergency admissions. It has lessened the number of urgent safeguarding interventions that is that as much as we think should have been happening among us. So in a very big in a short term, I will say that compassionate help has helped to help the system to be more connected to our people in terms of having early intervention and putting actions in place in terms of supporting with mental health. Then there have been more, we have helped the system to be more efficient in terms of providing the services that is required. And then we have also helped the system to be more patient-centered. Next slide, please. So I'll also be talking about how the system is having economical impact on us. So this is, can I have the economical impact, please? So in terms of economic impact, I'm not going to waste much of our time. We all know that when we have a healthy mindset and our mind, both physically and mentally, when we are stable, we're able to work consistently, we're able to maintain housing and relationship, and that will reduce dependency on emergency services and welfare services. So this is the job that Compassionate Hub has done over years, helping to make sure that people are rightly connected. People stay healthy both mentally and physically, so that they will be able to maintain financially healthy state. And I will stop here. Thank you.
All right. Thank you so much, Mary. I am going to now call Olabode to talk about men-specific impact. Olabode, over to you.
Hi, everyone. Well, we'll be talking about the bridging the gap between Black men and statutory mental health. And this requires building, it requires clearing doubts and regaining trust. So this happens because a large number of Black men see mental health services as coercive, maybe even negative, as taboo in some cases, rather than being supportive. So mental health services in relation to compassionate health hub can partner with local BEM communities to build this relationship. It's very pertinent to build this relationship and trust, because this will further help to promote cultural competence. Over the course of this short presentation, I'm going to mention cultural competence a lot, because experience is the best teacher. And there is no way a foreigner or an outsider would have a lived experience more than someone who has lived that life. So that lived experience will help to create that information, that informed system that yes, mental health service can be presented in a more clarified way. And accessible support through compassionate hub is also very important because it helps to achieve growth, it helps to achieve sensitization and awareness amongst Black men. And this can be done through outreach, this can be done through organized work, meetings where Black men can get to speak their mind, talk without stigma. I know of while I used to go to the hospital with my wife, there used to be a group called Andy Men. Yeah, I think Andy Men. They are like a group where men come maybe on Mondays or Tuesdays, I think, where they come to talk on Monday evening. So this can also be created where Black men can, come to have conversations, and this is going to help over time. So in summary, we just need to shift from having doubts, having stigma, having negative thoughts to a culturally stable and relatable space that builds trust and equity over time. And then for also the providing insight into barriers, stigmas, and unmet needs. Yeah, we know that there are loads of barriers, there are a lot of stigmas that Black men also face in the society, and the Compassionate Hub has really helped to ensure that these barriers, these stigmas are limited. And we know that this barrier includes lack of trust in services because most times there are limited access to early interventions because when you do not trust a service, you are most likely not going to visit that service because you have doubts, you do not have clarity over it. You feel that this service might misdiagnose me or not understand what I am really going through, So there's poor cultural competence, like I said, among professionals, and it's not their fault, like I said, because if you have not lived a particular life, you wouldn't know how it really happens or how how you really feel about it. So for the stigma too, there's always masculinity norms, which is very common. This is not just about Black men; it's a general view about men because they feel that there's a pressure, either underlying or surface level, to be strong. Say big boys don't cry, but I think that's more of a fallacy now, and there's absolutely nothing wrong in shedding one or two tears. So there's fear of being judged. There's underlying stigma, shame, fear, denial. Compassionate Hub has helped Black men in the society and the community to ensure that we speak out. So this can also be improved with partnership and yeah, we also have the unmet needs too, and these unmet needs it's not just like creating what we just need to do more. We need to create more safe space for Black men. I mean, I'm talking in relation to how there can be collaboration with Compassionate Hub. We can also have trauma-informed and anti-racist approaches. So lastly, for the helps how Compassionate Hub helps partners design more equitable, culturally competent, and mental health pathways. So this is also a way that partnership can be done. This is a way of starting genuine partnership services. And this needs to be done to produce pathways with Black men, community leaders, and grassroots organizations. When I was talking about cultural competence the other time, it is also going to help to create opportunities for Black men in the organization, where you can invest and ensure that staff understands that there's a sort of structural inequality that needs to be met. Partners can always track outcomes to build solid data that helps with identifying disparities, identifying ethnicity issues that helps to make us better. Yeah, so lastly, for the location and access, the Compassionate Hub space is accessible physically at 15 Freeman Street, Grimsby, and virtually by email. Yes, it's on the screen there. We have the admin at thehealthgospel.co.uk or Emily Carter at thehealthgospel.co.uk. Then the helpline is also there, 07386225170. Thank you for your time. Over to you.
All right, thank you so much, Olabode. I'll leave the time to Dr. Ida to just summarize for a bit, then we'll take some questions. Thank you.
Thank you, everyone. Thank you for joining our presentation on the Compassionate Hub. We've talked about everything. So if you have any questions, observations, something you think we can replicate. So the meeting today was just how can this be something that other organizations can replicate? I think that within each organization, there should be some sort of mental health support. As we know, mental health is a big topic in our society. And if we have little groups that people can trust and come to you before things escalate, I think it's a very good idea. I know how many men, women, young people, families that have come to us in the past year that we've only existed, I think, 12 months, but we have prevented a lot of admissions, going to hospitals, going to have referrals and stuff, because we deal with the main issues, we reduce the anxiety, and we help them to solve like the immediate problems, which only culturally competence, if you're aware of what is going on. Like example of a man who ran to us, he was almost like going in like psychotic, but if you are not in the situation or understand his background, you would think that you get 999 and send him. But going through his situation as a migrant, his house was out, he couldn't get a place to live, and he was almost psychotic. So we had to solve the root problem and try to get him stable, and he's fine. He doesn't need no services, he's back to work and all that. So these are like community like support that we can give to relieve the load on the system. So if we have any questions, please, we are open to. Thank you.
I just wanted to say thank you to everybody for sharing, and thank you for, sharing, giving your time and educating us all about the Compassionate Hub. There was a couple of things put in the chat. I don't know if you'd seen them, Faith, or not. So I think somebody put in the chat, I think it was Claire, that asked if she could have a digital copy of the leaflet. So Claire heads up the like the food forum and all people that provide food banks, and she asked if she could have some leaflets, and I think Craig also put that in there as well. If you do have a digital copy, you can send it to me, and then I can forward it on to people that get this email as well.
Yes, I will do that. Thank you. I'll send the digital copy of the leaflet.
That's great. Yeah, brilliant.
And also, if there's any services like struggling with people from BME and probably would need support, that's why we're here. We can go in and see how we can support those individuals, because it's not everything that needs like to be referred to the mainstream system. So we can go in and try to support those individuals.
Brilliant. So this does get recorded, and we'll send it out, the link. It'll probably be next week when I upload it. But it does go out to everybody on our mailing list. And I think I didn't realize it was half term. So I think that's my fault, really. I'm sorry about that. But, I thought it was a great information sharing session, and thank you for your time. It's definitely made me think about a few things that we can do, and to share it with the community plan work, definitely. So thank you. If there's no other questions or comments, I can close the call, and we can all fantastic presentation. Adam?
Yeah, it was hi everyone, thanks for your presentation. Really useful to understand and know what's going on. Heidi, just a bit of a thing for you around some of the volunteer work and some of the community engagement work we're doing around the National Implementation Programme. We'd really like to do some work with some of the community, if we could, around neighbourhood health centres and development of that. Just thought I'd take the opportunity whilst I was here, Amy, sorry. So if I send you a bit of an email, and then if we could arrange a quick catch-up, would that be okay?
Yeah, Adam, yes, fine.
Yeah, lovely. Thank you very much.
Well, if there's no other questions, we can all get 9 minutes back now. Adam took that minute. And enjoy a bit of the sunshine, grab some lunch, and have a lovely afternoon. So thank you. Yeah, it was really lovely. Thanks ever so much, everybody. and
Thank
we'll see you
you.
all soon. So take care. See you soon.
Thank you.
Thank you so
Bye.
much.
Bye.
Bye.
Bye-bye.
Bye.